There are 4 basic dry eye therapies that everyone should follow. Some need more of one and less of another. Your treatment will be discussed with you as an individual. This will depend on what type of ocular surface dryness you have. At Poco Vision Care, we have no affiliation or shares in any of the products that we sell or recommend. You are not required to purchase products here. We provide what I've done research on and feel are the best and most economical for you. So let's get at it and learn about dry eye treatments.
The number 1 therapy for dry eye is ocular lubrication. Using eye drops and ointments will not stop you from producing your own natural tears. However, the exception is get the red out drops. They will actually decrease your own tear volume. We recommend drops that have hyaluronate with different concentration and preservative free. An example are iDrop Pure, Pure Gel, High-Low, Cystane Ultra, and Theostulo. The ones we sell here are the iDrop Pure, Pure Gel, and Theostulo. Why preservative free? Your ocular surface is irritated. Don't put more chemicals on it. Chemical-free drops have filters in the bottle and run more expensive than bottles with preservatives. The other advantage of filtered drops is they last longer. iDrop Pure is safe to use for over a year, and High-Low is good for 6 months. Now, bottles that have preservatives in them need to be discarded after 3 months of opening them.
iDrop MGD, the first of its kind in Canada. It is a premium, visco-adaptive, preservative-free artificial tear that is highly effective at hydrating and lubricating the cornea. Formulated with top quality hyaluronic acid and a lipid base. Its lipid structure is biosimilar to the meibomian lacking in meibomian gland dysfunction patients. The drop stabilizes the patient's decreased lipid layer, but enhances it while acting as an osmoprotectant and bioprotectant. The proprietary formula prevents lipid separation, so no need to shake the bottle, while blurriness time is decreased due to its transparency, unlike other mineral oil-based drops on the market. And finally, the bottle has softer walls, so it is easier to squeeze.
Ointments can be used at bed for more severe cases or when you sleep with your eyes open. The 2 ointments we recommend are Eye Defense from iMed, a Canadian product, and Ocunox from Candor, a German product.
iDrop Pure, Pure Gel, and MGD eye drops have a one-way valve filter. Some liquid will remain on the bottle top after a drop is dispensed. This confirms that the bottle is working as it was designed and not drawing the liquid back into the bottle. Simply flick it off with a brisk hand motion and close the cap properly. Don't flick it off with your fingers or wipe it on your shirt. This step is critical in keeping the remaining solution sterile and safe.
The second recommendation is hot compresses. Why? The oils in the meibomian glands become plugged up, especially with screen time. The oil that comes out of your glands every 10 seconds to seal your tears backs up because you're blinking significantly less. The oils need to be dumped out or else the glands are lost. Hot packs relieve this problem by liquefying these plugged up meibomian glands. Research has found that a face cloth is ineffective as the cloth needs to keep the correct temperature for 5 minutes, and a bag for your shoulder is too risky for burning your eyes. The bags we sell have a removable, washable exterior cloth. It needs to be heated in the microwave for 20 seconds, and that's it. Too long and it'll explode. The bag is good for daily use for a year. The bags work best if applied on work nights and should be used at least twice a week. Drape it on your closed lids for 5 minutes, but do not over tighten. If you're using an ointment at bed, do the compress before the ointment is instilled. If you don't have a microwave, we sell a special hot pack that can go in the oven to be heated. Please stipulate which type you require. The standard eye relief mask cannot go in the oven. Some individuals have an excessive amount of meibomian gland blockage, and the basic hot compresses will not get the oil glands flowing. They will need meibomian gland expression, an in-office treatment, or Ilux or LipiFlow. These will be discussed under procedures. Now, most people will continue using their drops and clean their lids, but they forget to do the hot compresses. This is the first thing they stop doing. Don't. Ocular surface disease is chronic and ongoing. Don't stop doing your hot compresses. The third recommendation for basic dry eye treatment is eyelid and lash cleaning, or lid hygiene. Remember, one of the functions of tears is it acts as an immune barrier. When this is broken down, normal bugs that live on our skin would become more abundant on the base of our eyelashes, where the oil glands are. Plus, if we wear contact lenses, we will produce more biofilm. The eyelashes are never generally cleaned, as normal soap will irritate the eyelashes and lid margins. This skin is very sensitive. If the amount of biofilm and bacterial overgrowth are reduced over the oil glands, a healthier tear film will emerge. So let's go and explain how to lid clean. I recommend and use the foam cleanser myself 3 times per week. To start, this should be done morning and night for 2 weeks to reduce the biofilm and bacterial overgrowth. Then 3 times a week for maintenance, forever. You basically take 1 pump in the shower, put it on your fingertips, and gently dab it on your lashes and brow, and then rub along the lash line with your eyelids closed. Don't forget to go under the upper lashes. Do this for about 10 seconds and then gently rinse off. If you're not a shower person and you're a makeup wearer, the wipes would be a better solution. There are different concentrations, some with tea tree and some without. The type will be discussed with you on what you need. On patients that have an excessive amount of biofilm, a normal daily cleaning will not be enough to remove it. This requires an in-office treatment called Blefx. I will go into this in more detail under office procedures. Some patients have told me that they use 50% baby shampoo diluted with a Q-tip to clean their lashes, and their family doctor actually recommended them to do this. Well, I used to recommend this too 30 years ago when I first graduated. However, if they had kept up with their research, they wouldn't suggest it anymore. So research has been done, studies over and over saying that baby shampoo is way too harsh. It actually takes all the oils away from the lash margin and actually causes more harm than good. So please do not use baby shampoo diluted 50% with a Q-tip or with a cloth or any form on your eyelashes. Omega-3 supplementation is the last of the basic dry eye treatment. The outer layer of the tear is made up of oil. This layer keeps the water layer from evaporating.
if the oil layer is too thick or of poor quality, then the tears will evaporate faster than the blink rate. Omega-3s help keep the oil in the tears at the proper consistency. Why only omega-3s? That's because our diet is generally higher in omega-6s and 9s, usually with a ratio at 15:1, where it should be 4:1. That is, we eat significantly more omega-6s than we do 3s. An example of 6s are processed vegetable oils and all your processed foods, where omega-3s can be found in fatty fish such as mackerel, salmon, herring, sardines, oysters, flaxseed, and walnuts. To help reduce this poor ratio, we need to supplement with omega-3s, not omega-3 6-9s. You simply can add in fish 3 to 4 times a week to do this, not tuna, which should only be eaten once per month. However, if you're allergic to fish, you need to take a flaxseed, ground or oil, dosage 5 grams or 10 milliliters respectively. Omega-3s from fatty fish is better absorbed than flax. Now, if you're not going to eat fish, then you need a fish oil supplement. The fishy facts about fish oil. They are not all created equal. Triglyceride form versus ethyl ester increases the absorption. So when you purchase cheaper ethyl ester forms, most of it goes through you. You thought that, wow, I saved all this money and didn't purchase what was recommended, but it really just ended up in the toilet. The next thing to consider is the amount of EPA and DHA. This should be over 70% of the amount of total omega-3. That is, in 1,000 milligrams of fish oil, the EPA and DHA combined should be 700 milligrams or higher. The third is the product should be free of PCBs and mercury and other heavy metals. Plus, it should be a deep water source of fish.
I have found a few good companies that make these requirements. We sell a Canadian brand here called TG Gold. You need 2 capsules per day. All fish oil must be taken with food and never an empty stomach or right before bed. If you have concern with the capsule size, another good brand is called NutriC. It comes in liquid form. It can be purchased at most grocery stores or health food stores. I recommend the apple or lemon flavor. I'm not here to sell you omega-3s, but provide you with a product that I know that works. You may have one you're already using at home. Just make sure it makes the grade. That is triglyceride form. The EPA and DHA should be over 70%, free of toxins, and a deep water fish. If you take blood thinners, check with your cardiologist first before taking any omega-3s. And to be safe, discontinue if you think you're pregnant and consult your physician before resuming. Keep all fish and flax oil in the fridge. And if you're using ground flax, grind it daily and use it up that day. It goes rancid very quickly.